My name's Sam Klempner. I'm a GI medical oncologist at Massachusetts General Hospital in Boston, Massachusetts, and I'm really happy to be here today to talk to you about some interesting topics. One of the most satisfying parts of our job is to see the people that really do well beyond what we would expect. And so these patients have been titled exceptional responders. And actually, there was an NCI directed effort to really understand exceptional responders. And for those interested, there's an excellent basic science paper characterizing some of the recurrent genetic alterations in these tumors that are associated with exceptional response. I've been fortunate enough to have a few exceptional responders. I think my most recent exceptional responder has been a HER2 positive patient. And this is a patient who presented with advanced disease and a lot of disease in the liver, someone who we would generally worry about, and unfortunately is not an uncommon presentation. Biomarker testing revealed the patient to be strongly HER2 positive, so IHC 3+, and a high level of amplification, FISH ratio of about 16, corresponding to over 100 copies of the gene on next generation sequencing testing. So this was maybe set up as someone who was biologically dependent on the HER2 pathway, and maybe they were predisposed to be an exceptional responder. But certainly we gave the patient standard of care, 5-FU platinum and trastuzumab. And by 3 months, the patient had had a near complete resolution of the hepatic disease, which was now no longer FDG avid and nearly resolved on CT scan. And this is now about 6 years ago. So the patient transitioned from 5-FU platinum and trastuzumab to 5-FU and trastuzumab, and then ultimately to trastuzumab alone as a maintenance therapy. And lives an entirely normal life, comes into clinic, feels great. We monitor with scans, we monitor with echoes as per the trastuzumab label. I fully expect at some point this patient may develop acquired resistance, but to date that has not happened. Again, although this is an unusual story, certainly we can learn a lot from these patients and try to understand, are there features about the tumor or the patient or both that may allow us to identify these patients and really tailor therapies. But there's nothing more satisfying in our job than having a patient where you told them the median survival was around a year for newly diagnosed metastatic patients who are now coming in 5 and 6 years later to continue to correct you. And happy to be wrong about that one anytime.